morning, Meridian, and welcome to Business Buzz. Today we're visiting with Dr. Jesse Yancosek and Dr. Shaun Mar with Elite Chiropractic and Rehab. Welcome, gentlemen. Welcome to Business Buzz. Shaun, good to see you. So, gentlemen, tell me a little bit about your backgrounds. How long have you both been practicing chiropractic medicine? Jesse, we'll start with you.
Yeah, I graduated from Shaun Mar Chiropractic College in Daytona Beach, Florida in 2021. I spent my first year practicing chiropractic in California and then moved out to Idaho last year. And I've been here since.
Okay. And Shaun, you've been...
I've been practicing. I graduated in 2014 from Cleveland Chiropractic. I'm from Kansas, and I moved out here. I've been practicing, rolling on my 10th year now.
Okay, well, excellent. So, you guys, we were talking a little bit earlier, and I've been to a chiropractor a couple times in my life, but what is a sign that someone will get when they probably should seek out your chiropractic services? What type of sign they should be looking for?
I always, well, obviously, a lot of people, I mean, anyone can benefit from getting screened and checking for movement inequality or, ranges of motion, strength imbalances, things like that could lead to injury. But I think the thing I tell most people, especially that they don't think of, is if they've got that recurring low back or neck pain, but let's just say a low back, that recurring pain, it just keeps showing up every 6 months. No rhyme or reason to it. They're not sure what to do about it. No
injury cause or things like that.
They woke up or they watched a movie and now they can't stand up. And they can, but it's sluggish for them to get fully, upright. And there's something you can do about that. There's a reason that's happening. And that's especially what we hang our hat on here at this office is kind of educating that population on how they can break that cycle, why it keeps happening to them, and what they can do at home, what they can do here with us, and just giving them tools to help themselves get better.
You mean it's not just old age and your body breaking down?
No, but there's so many things to understand about how to minimize that, so it doesn't become that cycle that people get stuck in. They don't feel great. They don't feel bad enough. They don't know what to do about it. They just ignore it, and it just keeps going on.
Okay. What can a patient expect when they make an office visit here with you, Jesse?
Yeah, so patients can expect, pretty traditional chiropractic here. We like to coach our patients through functional assessments and corrective exercises. Another thing that we like to pride ourselves in is convenience and availability. Having 2 doctors on site is awesome, and we have an excellent staff here. So,
okay, I see the typical things in the office that I see at chiropractic office. You got a table for manipulation and things like that. Yeah. Shaun, what's a little bit maybe the philosophy or approach to patient care? How do you?
Yeah, well, we actually, like Dr. Jesse's saying, we do, the adjustment that you're probably familiar with. But we try to add so much more. We try to do it at the highest level and offer, again, a lot of that patient education. I think is something that, is a staple of our office. Is that patient education, and then we have one-on-one coaching with all our corrective exercise, and that's done, right here along, this area or in the treatment rooms as well. We have staff, we have rehab techs, and so we are able to give patients tools that they can keep using at home. And again, that's incorporated in every visit, but then, as well as, again, they're in addition to their normal adjustments.
Okay. Yeah. And guys, what kind of sets you apart from the many other chiropractics that we have in the Valley here? Yeah. You touched on some of your approach, but sure. What do you feel like really sets you apart?
I know we do, like I said, the coaching is a huge piece. And Dr. Jesse referred to our flexibility with our schedule. With us both here, pretty much every day of the week. Like I said, our staff's awesome. Jessica's, a rock star. We are able to make it really flexible for people so that they can, because it's, again, we get it. People are busy, have things to do, but so we have to kind of work around that for people and make sure that that's, that they can do both. And so with 2 of us here, that we're able to do that. And again, to continue to do it at a really high level. We also offer dry needling with a lot of our tendonitis cases. That's something that is absolutely, a game changer as far as treatment goes. With the right cases, when it's what's needed, it's the gold standard for tendonitis, trigger point work, things like that in the muscle.
Okay.
Yeah.
Jesse, what's a typical length of visit someone needs to see and frequency that you like to see a patient on?
Sure. Yeah, our visits will range. I mean, it always depends on each patient, but you know, you come in, you get an X-ray, or you know, if it's necessitated, we'll get an X-ray. But yeah, we'll walk you through some rehab and we'll get you adjusted. It can range anywhere from 10 to 30 minutes. So
okay. So, and then depending on the type of need, the rehab and stuff, the frequency is
that's obviously
that's always one of the big concerns is is it something you can correct, or is it something that's just going to have to be ongoing?
Yeah. Well, and that question gets, can get answered pretty quick usually. I mean, you when you see the case that like just checks all the boxes that you've seen 1,000 times before, like it helps. It's a good thing, your expectations wise, what to expect, what that's going to look like, how their day to day and how their progression is probably going to happen. And so you can really account for that. And then, like Dr. was saying, like it could range depending on what kind of rehab we're doing, if we're adding the dry needling in with, for other things, like if it's like a shoulder issue or an Achilles or something like that. So, yeah.
Okay. Gentlemen, where's your office located and how can people find out more about you?
Yeah, we're located here right off the freeway in Meridian, right off of Meridian Road, south of the exit, pretty close to, Overland and Meridian.
Kind of across from Wahoo's, basically. Yeah.
Dutch Bros right over here on the corner.
Dutch Bros, Wahoo's,
Okay.
And you can find us on our website at www.elitechiroprehab.com.
Yeah.
Okay. And then email address, probably one there for you.
Yeah, you can
reach
email,
out to us. Call
the office. Again, someone, you can always message us off hours too. Someone will reply, by 8:30, 9 a.m. the next morning, if things ever need to be, changed. And then as far as questions and stuff, I mean, anytime someone has a question, we always invite them to come in, and because it's, in this world, you have to kind of get hands-on, at least see the patient and tell them, what we can do, or if there's something that can be done to help them.
Okay.
Yeah.
Well, guys, thank you so much for joining us today on Business Buzz.
Thank you.
Really appreciate you being a chamber member. Thank
Thanks.
you. Thank you, Meridian, and have a great weekend.